During the summer, back in the late 90s, around 1995, 1996, my father was diagnosed with diabetes. He had gained a bunch of weight and was diagnosed with diabetes, placed on, I believe, metformin. And for a while, he was coasting along. And then just a few months later, he started to lose weight precipitously. But at the time, I was doing my radiology residency at William Beaumont Hospital in Royal Oak. And I went to the hospital with him for something or other. I forgot what brought him to the hospital, but the radiologist at the hospital in Lansing knew that I was a radiology resident. And after bringing my father back to get his films, the radiologist came out into the waiting room and motioned for me to come back into the private area there. And without saying very much, he put up my stepfather's films on the altimeter there, and I knew right away it was like getting punched in the gut. I see cancer all over the place, cancer all over his kidneys, crawling up to his lungs, metastases everywhere you looked. It was very obvious. A high school student could have figured out that this was cancer. It was so bad. I knew that was a death sentence. And the thing that shocked me the most was the fact that I was utterly shocked. Nobody was even thinking cancer. He didn't smoke. He didn't drink. He had some problems with his blood sugar, had a slightly high weight. I mean, by today's standards, he wasn't morbidly obese. He was overweight, but not grossly so. But yeah, it was cancer. And he was dead within, 4 or 5 months. It was over. The shock of that moment, it's kind of stuck in my head, when I saw those films, and it was like, boom, guess what? Surprise, surprise. A mortal surprise. Wow. That was a gut punch. Cancer is not something that just sneaks up on most people. For most of us, it's a consequence of choices that we made, or it's a consequence of things we were exposed to, not necessarily in accordance with our wills. People get cancer from secondhand smoke. People get cancer from carcinogens in the environment. People get cancer from exposure to sunlight, for crying out loud. Okay? So it's not a consequence necessarily of bad behaviors, but it can be. Now, one of those things that is known to cause cancer that's very huge, and even though I'm going to be talking about natural things to help reduce your risk of cancer, I would be remiss if I didn't discuss the elephant in the room, which is our own insulin levels. Our own pre-diabetes is a major, diabetes and pre-diabetes, because they involve insulin resistance, because they involve elevated plasma insulin levels. Insulin's a growth factor. It does promote cancer. It is probably one of the most modifiable things that you can do to reduce your risk of cancer. I have to say that I can't stress that enough. So even though I'm talking about supplements, please keep in mind that you need, if you're pre-diabetic, you need to reduce your fasting insulin levels. Watch my video on the insulin reduction protocol. I highly recommend that and get that down. That would be the biggest thing that you can do to reduce your risk of surprise cancer. Having said that, let's move on. Now, what I'm going to be talking about today is a proposed mechanism. What this means is I'm not proposing this as this is the cure for cancer. For sure. If you do this, if you take these 3 supplements, you will never get cancer. I am not promising that at all. I'm going to present to you these 3 supplements have low side effects, low likelihood of side effects, but there is a likelihood that it will kill baby cancer cells before they turn into cancer. Most cancers, in fact, all cancers don't start out as full-blown cancer, as in something that's giving you symptoms that there are billions of cells, of cancer cells floating around in your body or in a tumor, and they're causing symptoms. They're eating your food, they're cutting through nerves, causing pain, making you lose weight, all that stuff. Before it gets to the monster that it is when you go to the hospital and see it on the x-ray, it's a baby cancer. It's a little guy. It's not a billion cells. It's a few thousand cells, a few hundred cells. And it can exist in that baby cancer state sometimes for years. okay, without blossoming into a full cancer. On autopsy, we find a lot of people have cancer. Now, they didn't die of the cancer, but on autopsy, we found that even though they died from a car crash, they died from a heart attack, still, we look and we say, guess what? They had prostate cancer. Guess what? She had breast cancer. So eventually that cancer would have grown up, but it wasn't allowed to because they died of something else first. Now, what do I mean? Well, just to give you an example here, breast cancer. At autopsy, if you make it to age 80, about 15% of women will either have had breast cancer or will have in their lives at some point, or they have breast cancer on autopsy. About 15%, okay? Now, for men, it's worse. When I think of all the attention to breast cancer, I thought for sure that women had it worse. It's actually not true. Men have it worse. If you live to 80 years old and you're a man, what do you think the likelihood is that you have some prostate cancer? How about 59%? Roughly 60%, 6 out of 10 men, if they live to 80 years old, are going to have prostate cancer. Doesn't mean they're going to die from it, but at autopsy by 80 years old, 60% of men are found to have prostate cancer. That's a lot. Prostate cancer is the number 1 cancer of men. Number 2 for both sexes is lungs. Number 3 is colon cancer. All right, but those are the big 3. But prostate cancer kills a lot of people. And that's what I'm proposing today, especially for men and for women with breast cancer too, is I'm proposing this protocol as kind of a large-scale clinical trial. For those of you that want to participate, just let me know in the comments if you want to participate and you want to do this. So it involves maybe 1 to 2 weeks per month of using this protocol to see if in the next 20 or so years, does it protect you from breast or prostate cancer, given how prevalent these cancers are. So that sets you up for what we're going to talk about today. Now, we have some molecules in our food, in our environment, some supplements that have the ability to alert our cells that we have a cancer and to alert our immune system to kill the cancer. Now, some of them have very powerful effects, some not so much. Just about all antioxidants can reduce your cancer risk because cancer often starts with mutation. My PhD was in experimental pathology. My doctoral dissertation has to do with lymphoid neoplasia, looking at something called heptamonomer palindromic repeats in lymphoid neoplasia. It was a long time ago, many, many years. But essentially, I had to learn a lot about the genetics of cancer in that program. Before a cancer starts, very often there is a mutation involving a tumor suppressor gene, and then the cancer grows prolifically when those genes are taken out. Now, I'm not so sure about that premise anymore. The primary insult may be a metabolic disturbance in the mitochondria, and with the mitochondria are poor, then you're more likely to have an influx of free radicals, which therefore lead to these mutations. So regardless, mutations are involved, and these cells that used to be us, that used to be our friends, become transformed. It's like they get converted to this crazy cult, and instead of working for us, now they are working for themselves, and they are growing out of control. They become sinners in a holy land, right? And they are working to destroy us because they're completely unregulated, all right? The first of these substances is from oolong tea. The only way to get oolong oobisflavin B is from oolong tea, as far as I know. And this is a flavonoid that has the unique property of binding to a very important molecule in your body. And that molecule is called 67LR, or 67-laminin receptor. Now, there are cells in your body that express 67-laminin receptor. 67-laminin receptor is something that cells express when they are distressed. It's kind of like a flare. Help me! Need rescue, SOS. That's what happens when cells express the 67 laminin receptor. Now, cancer cells are distressed. Most cancer cells, the overwhelming majority of cancer cells, have problems with their mitochondria. In a healthy cell, the mitochondria are able to burn two fuels. They can burn fat through oxidation of ketones, or they can burn glucose. And that's what healthy cells are able to do. The cancer cells have sick mitochondria so that they're able to burn glucose, but not so much fat. Some cancers can, but the majority of cancers cannot burn fat. That puts them in a state of distress. Even though they're getting along fine with glucose alone, they're not doing well compared to a normal cell, okay? And so the 67LR receptor is expressed, and it is overexpressed in the majority of the cancers that people get. They are expressed so much that you can actually tell the difference between cancer cells and normal cells because they're expressing it so much they identify themselves. And that's really important to know because when you're treating cancer, you want to find something that is unique to the cancer that you can target, okay? Because when you're doing a chemotherapy, the most important thing is, okay, yes, you have a toxic substance. Cyanide is toxic. Cyanide will kill cancer cells. Unfortunately, it kills you too. So we want something that's going to attach to the cancer and terminate the cancer without terminating you. That's the holy grail of cancer treatment. So the 67LR receptor is expressed on, as I mentioned, the majority of the cancers that plague humans. Breast cancer, ding ding, that's number 1 for women. Lung cancer, number 2 for men and women. Ovarian cancer, that's a big one for women as well. Prostate cancer, number 1 for men. And then we have leukemia, lymphoma, cervical cancer, colorectal cancer, esophageal cancer, bile duct carcinoma, laryngeal squamous carcinoma. A lot of smokers get that, right? Multiple myeloma. My uncle and my biological dad both died of multiple myeloma. Gastric cancer. Just had a friend die of gastric cancer this last year. Pancreatic cancer. It's a lot of people there. Fibrosarcoma, and the list goes on. It's more than that. So this is a really big deal. Having something that will do something to that receptor could be really helpful in the treatment of cancer. Now, what is that receptor doing? What's going on? It's called a receptor, which means it probably binds to something. What does it bind to? Well, it's called the 67 laminin receptor. There is a clue. It binds to laminin. Laminin is a protein found in the basement membrane of cell systems, of tissues. And so it's kind of ubiquitous in your body, all right? So when those receptors come popping out and these cancer cells express these 67 laminin receptors, as long as laminin is not present, then it doesn't go into full-on cancer mode. Okay? It doesn't go into beast mode. It doesn't start behaving like a cancer cell. Now, what do cancer cells do that's different from normal cells? Well, normal cells are very polite with each other. They don't overrun one another. There's something called contact inhibition that normal cells do. When they come up against a wall, they say, you know what, this wall's here for a reason. How about I not burrow through that wall? When they come up against each other, say, hey, pal, hey, how you doing? We're next to each other. I'm not going to crowd your space, not going to eat your food, not going to populate over top of your head there, right? Cancer cells aren't like that. They keep going. They bore through halls. They lose contact inhibition. They forget about density-dependent growth. They keep going. They keep stretching out. That's a cancer cell. When the 67 laminin receptor comes in contact with laminin, that cancer cell goes into freaking beast mode, and it starts to behave like a cancer cell. It starts to avoid the rules, it starts to spread, it starts to multiply, it starts to metastasize. That's the magic bullet. When 67LR comes in contact with laminin, kapow. Now, if you can separate 67 laminin receptor from laminin, you can turn that process off. Now, when the process is turned on, see what happens normally is this. When a cell line becomes transformed, when a cell line becomes cancerous, if it's not supercharged with laminin, there is a switch that goes off in the cell automatically. I am a cancer. And it self-deletes. It activates a pathway A lot of cyclic GMP involved in that pathway. And that pathway ultimately shuts the cell down. It enters into apoptosis. It goes into suicide mode. That's what's supposed to happen. So it's not atypical for cells to become transformed, to become precancerous. But when they do, the natural thing is for them to go through the suicide. However, once they come in contact with laminin, that's a bomb that goes off. They override the suicide signal. So we need some way to stop the 67LR protein from becoming supercharged. Now, if you watch vampire movies, there are a few of them out there where the premise is that once a person drinks vampire blood, they turn into a pre-vampire. In other words, it's not quite permanent until they make their first kill. Once they make the first kill, okay, you're committed to being a vampire from now on. That's kind of what it's like when laminin binds to the 67LR receptor. It commits to doing that. But you can uncommit by taking that away. So what happens when 67LR receptor binds to laminin? Enhanced cell adhesion, migration. That means it starts squirming its way around and going through the tissues. It upregulates gene expression so that you end up with genes that make this cell behave cancerous. So it improves its malignant potential. Okay. Now, we have drugs, there are investigatory drugs, specifically designed to bind to the 67 laminin receptor. There's one called NSC 47924. And what it does is that it binds to the 67LR receptor, and when it does that, it disrupts the LR laminin interaction. And that has been shown to reduce cancer cell invasion and metastases in preclinical studies. Okay, so wow, what a great molecule. We should be giving this to people, right? Right now, it's not available yet, at least. One reason why this might not come to market is that there is something in nature that binds even stronger to the 67 laminin receptor, and it's this molecule, oolong homobisflavin B, that is found in oolong tea. It binds considerably stronger to that receptor, and it is able to displace the laminin. Therefore, when that happens, it causes that it turns off that aggressive response, and it activates the suicide pathway. Okay, so you think, wow, this is really great. And we've actually tested this in certain cancer cells, and it worked. We actually use oolong homobisflavin B to treat cancers. Now, these are in animals, so we don't have human studies yet, but they've actually found tumors that were very sensitive, tumors that were rich in 67LR, treated with oolong homobisflavin B, and it actually killed the cancer. It stimulated apoptosis of those cancer cells. Now, the problem, though, is this. How much tea do you have to drink to get those anti-cancer effects? Turns out a lot of tea, okay? A lot of tea. And we're talking minimum like 30 cups a day. It's like, oh, shoot, yeah, that's crazy. And one of the reasons that you have to drink so much to get that the dose that you would in those animal models, and again, we really don't know what the effective dose would be because we just don't have the study. So it's not like we know for sure what the right dose would be for humans. Okay, but we do know that the absorption, the bioavailability of oolong homobisflavin B is not huge. And one of the reasons why oolong homobisflavin B, if you drink the tea, one of the reasons why the anti-cancer impact would not be as big as you want is because in our bloodstream, we have something that slows it down. Okay. So in this picture here, we're seeing the oolong homobisflavin B binding to the 67L receptor. And here, that's going to activate adenyl cyclase, which raises cyclic AMP. This graphic, I don't know where I got this. I got this on the internet somewhere. Okay, this graphic is actually incorrect. It is not adenyl cyclase, it's guanylyl cyclase, and the molecule is cyclic GMP, not cyclic AMP. But everything else is correct. So when oolong homobisflavin B binds to the 67 laminin receptor, it hyperstimulates the production of cyclic GMP, which ultimately causes the melanoma cell that they looked at in this trial. It inhibited its growth through this process and ultimately caused apoptosis or killing of the cancer cell. Here's a limitation though. In living organisms, in living animals, we have a substance in our blood called phosphodiesterase 5, PDE5. And phosphodiesterase 5, it knocks out cyclic GMP, cyclic AMP, okay? And and the problem is that's what we want to increase. The oolong homobislavin B, one of the first things that it does in this pathway is raise cyclic GMP. But we have this stupid stuff in our blood that knocks out that effect. It reduces it so much that you would need massive amounts of oolong tea to override this. So what are we going to do about this? It's not that the oolong tea won't be helpful. It's not that it won't do anything, but its effect will be limited because of that. Because, that phosphodiesterase E5, it blunts the whole signal. So there is something you can do. If you add a little something to the oolong tea, you can override this limitation. This thing is called DAD. DAD stands for diallyl disulfide, and it's present in pretty large quantities in garlic. Now, it's present in other things as well, but mostly it's present in garlic. Diallyl disulfide. Now, that by itself has a lot of beneficial effects. I had no idea that garlic was so beneficial. It has anti-cancer properties, anti-inflammatory properties, antioxidant activity, cardiovascular and lipid metabolism benefits, and neuroprotective effects, okay? It's like for example, if you have a stroke, and right after a stroke, there's this really intense inflammatory reaction that goes on in the area of the infarct. It actually helps to reduce that, to reduce the damage post-stroke. So look at all these benefits, man. And that's just the diallyl disulfide. And there are other things in garlic that have even other health benefit properties. So it's really, garlic is just an amazing medical food, okay? But I'm going to be talking about the anti-cancer properties. And specifically, what diallyl disulfide does is that it breaks down phosphodiesterase 5. And if you take that out of the picture, now oolong homobislavin B can do its job and bind to the 67LR receptor, therefore keeping it from binding to laminin and stimulating apoptosis of the nascent cancer cells. So by using this combination, we're talking about synergy here. So using this combination, you are inducing apoptotic cell death in the baby cancers, okay? That's what we're doing. And so again, we don't have human trials. I don't know exactly what the correct dose should be. We just don't have that. And the problem is, with medicine, is that it takes like $1 billion to get a drug FDA approved because of the expense of these investigatory trials. Nobody's going to spend that kind of money for something as cheap as oolong tea and garlic. There's no money to be made, so nobody's going to do that. So in spite of the fact that on paper, this looks fantastic, ain't nobody going to do that study. So if you're waiting for clinical trials to prove this works, good luck. So I'm making myself the clinical trial, so I'm going to be doing this from now on. I mean, there's really no significant side effects, and the potential upside is huge, especially since I got a 60% chance of getting prostate cancer by the time I'm 80. And for me, that's not that far away. All right. So anyway, if you want to go along with that and try it out, here's what I would recommend. For each 8-ounce glass of oolong tea that you're going to drink, you take 1 teaspoon of the leaves, okay, of oolong tea leaves. You boil it and let it simmer for at least 20 minutes. There are no shortcuts. It needs to simmer to get oolong homobislavin B into that water, okay? And you want to drink for 7 days a month. You want to drink 2 to 4 cups per day of oolong tea. And with each cup of tea that you're drinking, you want to take 2 garlic capsules, okay? That's like 1,000 milligrams of garlic capsules. For each of those, every time you're drinking the oolong tea, take a couple of garlic capsules with it, all right? And the idea is this will find those baby cancer cells that are just fulminating in your breast or your prostate or your stomach or your kidneys or wherever they are. It'll wake those babies up and say, hey, little baby, here's a little something for you. How would you like some oolong homobislavin B, pal? And those cells, instead of binding to laminin at one day, or maybe they're already started, can displace that and get those guys to self-delete so that later you don't need chemotherapy. You don't need radiation and surgery, maybe. Okay? So that's my proposal. All right. So that's for this. Now, I was going to wrap it up and just say that's all you need to do. And then I came across something else because I started thinking, because this how this happened was I'm talking to Grok about this. I love Grok. Grok is awesome, right? And it gives me so many great ideas. So anyway, as I was talking about this, I was thinking, because I was trying to understand the mechanism of how oolong homobislavin B kill these cancers. And I thought there has to be something to do with the natural killer cells because, when I was in cancer research, it was all about natural killer cells. Those are the white blood cells in your body that are responsible for detecting and killing cancer. And when people ended up with cancer, it's because your immune system didn't do its job. Why didn't it do its job? Why did the esophageal cancer evade detection by the natural killer? That was your security, man. What were those security guys doing? Was it because you had some kind of disease, because you're getting old, whatever? They didn't do their job. So I thought, well, maybe this whole thing with 67LR had something to do with it. Nah, has nothing to do with your white blood cells, nothing at all. It's all about getting those cells to self-delete. So I said, well, is there a way, though? Is there a way we can increase the effectiveness of your natural killer cells? Because I hadn't looked at this area in years. I mean, my PhD was over 20 years ago. So I said, well, nowadays, do we have something that can increase the functioning of the natural killer cells? Turns out there is. Not too many things, but one of the things that has solid evidence that it raises the effectiveness of your natural killer cells is something called interleukin-15. Now, you can raise interleukin-15 with LPS, but man, you don't want to do that because that's some nasty stuff. Okay, it can actually, in some cases, cause other problems, and so nobody in their right mind would inject themselves with LPS in order to raise their interleukin-15. So we need something safe that you can do that to. Now, there are drugs that will raise interleukin-15, very expensive. They're $8,000 to $10,000 a month. So, but they really whack it up, and it can treat certain cancers like multiple myeloma. So, what you do is you jack up your natural killer cells with interleukin-15, and now you can go after the cancer if you got the money and great insurance, obviously. But I want to know, is there something natural that can raise interleukin-15 so that my natural killer cells can be more efficient at killing them cancer cells? Turns out there is. It's a little something called beta-alanine. I never heard of beta-alanine in my life. And apparently people that work out more than I do, they've known about it a long time because people have been using it to get bigger muscles for some time now. Beta-alanine, it increases carnosine in your muscle. And when carnosine goes up, it does all kinds of things. I mean, there are huge performance benefits. So if you are involved in a really intense exercise regimen that's very stressing on the muscles, carnosine maintains your power. It allows you to go longer, increases stamina, increases your performance. It also works on your brain. When carnosine goes up, you end up increasing brain-derived neurotrophic factor. You get improved cognitive function. You make fewer mistakes when you're fatigued. So we've known that, man, this beta-alanine, by boosting up carnosine and increasing brain carnosine, we're enhancing athletic and mental performance. This is really good stuff, and people are taking about 7 grams a day of this stuff, and they're getting these benefits, right? Turns out another benefit of this is that it raises the amount of interleukin-15 in your serum, okay? And when interleukin-15 goes up, as I mentioned, it enhances the effect. It basically takes your natural killer cells from a dormant state and it puts them into Hulk mode, okay? So a single natural killer cell floating around, then he comes in contact with some interleukin-15, right? And he says, and the natural killer cell starts to multiply to make more natural killer cells, and each one of those guys is in Hulk mode. And then they go hunting for some cancer cells, all right? Boom, boom, all right? That's how they work. And so when you take these drugs, when you take bortezomib, you jack up interleukin-15 to like huge degrees. I mean, way more than you would naturally, all right? And that's how you go after multiple myeloma. And it's approved for multiple myeloma and mantle cell lymphoma. And it functions by jacking up interleukin-15 levels so that your natural killer cells will do their job. Now, beta-alanine likewise raises interleukin-15 levels. Not nearly as high as bortezomib, but higher, demonstrably higher. It raises it in the brain, it raises interleukin-15 in the muscle, and it raises interleukin-15 in the serum. So by doing so, will that then lead to lower cancer? Because your natural killer cells are going to do the job better? Don't know, because again, we're not boosting it to chemotherapy doses that you would see with the drug, but you are demonstrably raising it. So theoretically, it may work, okay? Now, again, with the drug, you are raising interleukin-15 by about 34 picograms per milliliter. That's whopping, and that's effective to kill a raging cancer. With the beta-alanine at 6.4 grams per day, you're raising about 1.24 milligrams per milliliter. So considerably less. But again, we're not using it to treat a raging multiple myeloma. You're using it to treat baby cancer cells when they're first starting out. In looking at beta-alanine, I'm just so impressed with what it does in terms of helping your physical performance as far as exercise performance and endurance, increasing the size of your muscles. I like that one. If you exercise, you get way more benefit, by the way. With beta-alanine, I'd recommend, if you're going to use beta-alanine, please do some exercise, because the benefits of your exercise will be more pronounced in the face of beta-alanine, okay? And as we get older, sarcopenia becomes a problem. We lose muscle mass with age, especially if you've been on Ozempic, all right? You lose muscle mass like crazy, and it's hard to get muscle mass after 60. So here's something that can actually support muscle mass and help you to get back some of your muscle mass. So really helpful. Also, it has antioxidant and anti-aging effects. So who's against that, right? So wow, I'd like some of that myself. So there are a number of reasons besides cancer prevention to take beta-alanine. What is my new recommendation for this trial that I am recommending? And I don't know, I don't get a lot of traffic on these things, so I don't know how many people are going to want to do this, but if you're over 60, I recommend giving it a shot. And I'm going to talk about potential side effects next, so that's coming. I'm not going to just say do this and there are 0 side effects. I do want to discuss that. But so what I'm recommending is the oolong tea thing that I described, taking 2 to 4 cups of oolong tea for at least 7 days in a row each time with a couple capsules of garlic. But at the same time, during that week, taking 8 capsules per day of the beta-alanine. Now, each capsule is about 850 milligrams. So ultimately, you're taking, about 6.8 grams of this per day. All right, now you want to divide this up. You don't want to have it all at once. So you want to split it, maybe split up those 8 capsules into maybe 2 capsules 4 times a day, or if you can tolerate it, 4 capsules twice a day. What's the problem with taking a bunch at once? There is a side effect to beta-alanine. There is a side effect, and that is at higher doses, it can make you feel very tingly, paresthesia, that pins and needles sensation in your extremities, okay? That pins and needles thing. So if you're taking too high, it's not harmful in any way, but it can freak you out, and it may be uncomfortable, and it may last for a while. So, and by a while, I mean like an hour or so. So if that's happening to you, cut back on the dose. Don't take so much at once. All right, so now, are there any other things you need to be aware of? Well, if you're taking a reasonable amount of oolong tea, I'm not really concerned too much about a lot of side effects as long as it's within reason. I am not recommending 30 cups a day, by the way. Okay, so, as I mentioned, the dose there. So with oolong tea, the side effects, I wouldn't recommend taking it at bedtime. It might be a little too stimulating. Now, with regard to the garlic is known to thin the blood a bit. Okay, now I say a bit. It's not huge, but garlic does that. So if you are on blood thinners, Garlic is not going to make a huge difference, but it can. It can. So you don't want to use a huge amounts. But in the trial that I'm recommending, these are not huge amounts. People have actually done studies on how much garlic increases bleeding time, and here we see in one case they looked at 2,400 milligrams of garlic at once, and it just raised it from 3.25 to 8.28. These aren't huge. Nobody in this study had any symptoms of excess bleeding, by the way. So it's pretty safe with regard to that. But that's something you want to be aware of, especially if you are on a razor's edge with regard to hemostasis and you have really bad bleeding problems. Maybe you don't want to take garlic, okay? But if you have normal bleeding issues, I wouldn't hesitate. Okay. So anyway, there was no excess bleeding noted when eating less than 10 grams of garlic per day. Okay. And we're not recommending anywhere near 10 grams a day. We're talking, much less. And I talked about the side effects of beta-alanine, just those paresthesia. Okay. So no toxicity, but you want to space that out specifically because paresthesia can be unpleasant. So you want to divide that up, as I mentioned, and maybe you might have some mild tingling, but again, it will go away and there are no long-term consequences. All right. So having said all that, the objective here is not to say I'm going to guarantee you'll never get cancer, because I don't know what you've been exposed to. I don't know what's already going on in your body. And we're not really sure as to whether or not these doses are 100% effective at killing all baby cancers. Don't know. Studies have not been done. But I present the data to you. Go ahead and look it up on Grok or ChatGPT. Ask the questions yourselves and decide for yourself, considering not only the low toxicity, but the upsides. If you do a ChatGPT or a Grok on any one of these individually, the health benefits are huge. And if you add these supplements to your daily routine, the health benefits very much outweigh side effects. And you decide that for yourself. Don't just take my word for it, okay? But again, if you want to do this, let me know. And I'd like to follow. I'd like to, to check in maybe once a year or whatever and let us know how you're doing. And if anybody who's doing this comes down, is diagnosed with cancer, I'd like to know about that as well, so we can maybe compare that to the average. And after a decade or two, try to figure out if we did ourselves any good, okay? So anyway, good health to you, and I'll see you in the next video. Thanks for watching.